Hey everyone, and we're back for another deep dive. Today, we're going to get into something that I think is so cool, how we can actually control the heart's rhythm with medical tech.
It really is something else when you stop and think about it. We're talking about making these super precise adjustments to one of the most, vital organs in the body, using electricity to fix irregularities.
Irregularities that frankly could be deadly.
Exactly. And there's a whole bunch of ways we can do this, from those emergency life or death situations to things that help people over the long term. Let's jump right into the deep end with the most intense one, defibrillation. What actually happens in those critical moments when someone's heart is just, well, in chaos?
You're talking about ventricular fibrillation and also pulseless ventricular tachycardia. These are really scary situations because the heart's electrical activity is so messed up, it can't pump blood the way it should. And that's when defibrillation is absolutely, without a doubt, crucial.
Right, those sound like the kind of cardiac events you see on TV medical dramas where it's like every second counts. You got it. Time is critical here. The faster you do defibrillation, the better the chances of survival. Think about it this way. In these arrhythmias, that's the irregular rhythms, the heart's electrical signals are like a swarm of bees, just totally disorganized. They're all over the place, and it means the heart can't do its job.
Okay, so it's not just about a crazy fast heart rate, but a dangerously irregular one. So how does defibrillation actually fix that?
Defibrillation sends a controlled electric shock to the heart, and this shock basically resets the electrical activity. It's amazing, though. The heart wants to beat in a normal rhythm. It wants to self-regulate.
So it's like hitting the reset button, giving the heart a chance to reorganize and get back on track.
Exactly. That shock is like a clean slate for the heart, letting it go back to its natural rhythm. And sometimes it can happen so fast, like within seconds.
Wow, that is amazing. I bet using those paddles is a really specific process. It's not as easy as they make it look in the movies, right?
Yeah, you're right. There's a very specific protocol to make sure it's done safely and that it works. First, you have to make sure absolutely no one is touching the patient. That clear call you always hear is crucial.
Right, so no one else gets shocked.
Yep. You put these gel pads on the chest in a specific spot so that the electricity goes through the whole heart. It's got to hit all the pathways.
Okay, so it's targeted. What about the defibrillator itself? How does it know the right amount of shock to use?
The energy level depends on the person's size and what's going on, but it's always a controlled shock. You want to disrupt that chaotic rhythm, but not hurt the heart muscle itself.
Wow, so much goes into it. Now, defibrillation is for those extreme situations. What about rhythms that are bad, but not like an immediate emergency? I'm thinking of things like tachycardia, where the heart rate is really fast, but you can still feel a pulse.
That's where something called synchronized cardioversion comes in. It's another way of using electricity, but it's a little gentler. It's still a controlled shock, but it's timed with the heart's own electrical activity.
Oh, so instead of that hard reset, it's more like a nudge in the right direction.
That's a great way to put it. It's like fine-tuning, not like totally restarting it.
hmm
And because it's not as strong as defibrillation, it's often done with a little sedation so the patient is comfortable.
That makes sense. So we've got defibrillation for emergencies and synchronized cardioversion for fast rhythms that are serious but not quite as immediately dangerous. But what about those who are prone to these rhythms, long term?
That's where implantable devices like the ICD come, and the implantable cardioverter defibrillator. They're like a safety net, always watching the heart rhythm and ready to step in if needed.
So it's like a personal bodyguard for your heart, basically.
Yeah.
Tell me more about ICDs. How do they work?
That's a really good way to think about it, actually. They're implanted right under the skin, usually around where your collarbone is, and then they have these leads that go directly to the heart.
So they're like tiny defibrillators just kind of hanging out, waiting for the right time.
That's right. And that right time is really important. They keep track of the heart's rhythm all the time, but they only actually give a shock if they see a really dangerous rhythm, like ventricular fibrillation.
Okay, so nothing's constantly zapping. They're made to be really, really picky about when they step in.
Exactly. The tech behind them is incredible, sophisticated enough to know the difference between those dangerous rhythms and just like the normal ups and downs of your heartbeat.
That's good to know. Who usually ends up getting an ICD? Is it for anyone who's had any heart rhythm issues?
It's usually for people who've already had a sudden cardiac arrest, or if they're considered high risk for some reason. Maybe they've had a heart attack, or they've got heart failure, or even some genetic condition that makes them vulnerable.
So it's like a just in case thing for the folks who are most likely to have one of those really bad rhythms. Makes sense. But I imagine having one of those things implanted probably means changing up your lifestyle a bit, right?
Yeah, definitely. People with ICDs have to be careful around really strong magnets and electromagnetic fields. Those can mess with how the device works.
So, like, are MRIs totally out of the question?
Not necessarily, but it takes some serious planning with the medical team to make sure it's done right. And obviously, going to all your checkups is super important to make sure the battery's good and everything's running like it should.
That seems like a small price to pay for that kind of peace of mind, though. Since we're talking about these devices, I gotta ask about pacemakers. Are they similar to ICDs?
Well, they both use those electrical impulses, but they do different things. It's like, imagine an ICD as a security system, just there in case of a break-in. A pacemaker is more like your everyday assistant, making sure the heart keeps a good rhythm all the time.
Okay, so the ICD reacts, the pacemaker is more proactive. When would someone need a pacemaker then?
If the heart's own natural pacemaker, that's the SA node, if that's not working like it should, that's when a pacemaker comes in. You might have a heartbeat that's too slow, too fast, or just irregular. All of those can cause big problems.
So the pacemaker steps in and basically conducts, right, makes sure the beat is nice and steady. I'm thinking about how the heart has all those chambers. Are there different types of pacemakers for different parts of the heart?
You're right on the money. Single chamber pacemakers work with either the atrium, that's the upper right chamber, or the ventricle, the lower right. Then there are dual chamber pacemakers. They work on both. It's like having one conductor for each chamber, and then the dual chamber one is like the big boss conductor, making sure they're in sync.
I like that analogy. And
Yeah.
then there are the super specialized ones, right? Like those biventricular pacemakers.
Exactly. Biventricular pacemakers are often used in CRT, that's cardiac resynchronization therapy, mostly for people who have heart failure. They actually stimulate both ventricles, so they beat together, pump better, and improve how the blood flows.
It's amazing how each pacemaker is like designed for a specific job. Do all pacemakers send out those impulses all the time?
You not always know.
Yeah.
A lot of them, the demand pacemakers, they only kick in when the heart rate gets below a certain number.
Hmm.
They're always watching, though, kind of like a watchful guardian, ready to jump in when needed.
Oh, so they react, but not in the same way that an ICD does? It's wild how they just seem to know when to step in. How do they do that?
They've got these teeny tiny sensors in them that keep track of the heart's electrical activity. If the heart misses a beat, or if it slows down too much, bam, the pacemaker jumps in to keep everything on track.
It's amazing how they just kind of adapt to what the heart needs. We've been talking a lot about those long-term things like the ICDs and pacemakers, but what about those times when someone needs help with their heart rhythm, but just for a little while, like maybe during surgery?
Oh yeah, for sure. Temporary pacemakers are really important for those situations. Think about someone having open heart surgery. That temporary pacemaker can keep their heart rhythm steady while the surgeons are working.
So it's like a backup system until their heart is ready to do its thing again.
Yeah, exactly. Even after surgery, it can help make sure the heart keeps a good rhythm while it heals.
Yeah.
Just gives it that extra help when it needs it most.
Wow, cardiac care has come a long way, huh? All of these different ways to help, from those really intense, gotta act fast situations to those long-term solutions. But like with anything medical, there's got to be some risks, right? What should people know about those when it comes to, messing with the heart's electricity like this?
You're right, no procedure is perfect. The most common risks with these are kind of the same as any other heart or blood vessel procedure, infection, bleeding, that sort of thing.
Hmm.
With the implanted devices, the ICDs and pacemakers, there's a chance something could go wrong with the device itself, but it's not common.
Like what?
Well, sometimes those leads that connect the device to the heart, they can move a little, or in very, very rare cases, actually make a hole in the heart. But honestly, the tech has gotten so much better, and the surgery is so much more precise now, those risks are really tiny.
That's good to hear. So the risks are out there, but they're not super common. Still, it's good to know about them.
Oh, absolutely. It's really important for patients to understand everything, even the small risks, so they can make good choices about their own health care.
For sure. What about after the procedure? Any special care they need to do?
It all depends on what they had done, but generally we're talking about keeping the incision clean, managing pain, and getting back to normal activities slowly over time.
So easing back into things.
Exactly. And for the folks with those implanted devices, those checkups are key. Got to make sure the device is working, check the battery and all that.
It's like taking your car in for a tune-up, right?
Yeah, you got it. Got to keep those devices in tip-top shape so they can take care of the heart.
Man, we have gone over so much today. From those moments where the heart stops and you need a defibrillator, like right now, to all the amazing things they can do with pacemakers and ICDs. This tech is really changing the game when it comes to treating heart rhythm problems, huh?
It really is something else. We're not just saving lives, we're giving people a better quality of life, even with those heart rhythm issues.
It's amazing what we can do now that we understand how the heart's electrical system works, right? And the things they've come up with to treat it. It's really incredible. Well, everyone, that's it for this deep dive into cardiac electrical interventions. Hope you learned something new, and remember, this was just for informational purposes. For any health concerns, always talk to your doctor. We'll catch you next time.